For joining me today for this webinar called Is Cracking Your Back Bad for You? We're going to talk about the habit of cracking your neck or your back or your knuckles. So what's the truth behind the pop? Is cracking your own back good for you? And why do you have to keep doing it if it works? The pop's not the goal, and relief is not correction, but we really want to get down to what's causing the urge to crack your neck, your back, or your knuckles. Self-cracking can actually reinforce the dysfunction, and I'll get into that in a second. So what actually happens when you crack a joint? Well, there's synovial fluid in the joints, so we call these synovial joints, where there's two bones coming together, there's a capsule, and there's some fluid inside. There's some gas inside the fluid, so when we stretch the capsule, it actually causes the volume to increase and the fluid goes to one side, the gas goes to the other, and that's called cavitation, this word right here, and that causes the pop. It's like opening a Coke can and you get a pressure release. There's a neurological response because you're stretching the receptors in the joint, and that can block the pain pathway because the mechanoreceptors, the stretch receptors, are more powerful than the pain receptors. It causes a temporary pressure change, so it can feel good temporarily. Why does self-cracking feel good, but it doesn't fix the problem? Well, there's that neurological effect that we talked about and the endorphins that get released. They're like natural painkillers. They get released for about 20 minutes, but then they wear off, and then the urge is back to crack your own neck, back, or knuckles. And then there's that short-term nervous system inhibition if you're cracking your own joints. The structural reality is the restricted joint often does not move, so the one that needs to be adjusted isn't getting adjusted. And over time, this feeds into more instability and more instability in the mobile segments. So the cycle is cracking, which provides temporary relief, more instability, more tightness in certain areas. You have to crack it again, and then you go through this cycle over and over again. The risk of repetitive self-manipulation is ligament laxity over time, increased joint stability, instability, muscle guarding, dependency on self-cracking, and irritation of structures like in the neck area, the cervical structures. Well, how is chiropractic different versus do-it-yourself cracking? Chiropractic involves palpation, motion testing, safety screening, and controlled amounts of forces. And we use hands-on adjustments. Sometimes we use instruments to do the adjustments, which does not involve any cracking. The goal is to reposition the vertebrae and to release the pressure in the area. Self-cracking has random leverage, no assessment, no short-term, just short-term relief, but no long-term relief. So self-cracking is kind of a random process. So why do people feel the urge to crack? Well, the common drivers are forward head posture, thoracic stiffness, that's the mid part of your back, weak, deep neck flexors, core instability, and the stress response. So all of these things can build up tension in the body, and then you feel like there's a need to crack those areas. Sometimes it's just a bad habit. A long-term strategy for healthy spine and joints are strategic adjustments targeted towards the misaligned and stiff areas. Some home stretching to help you with flexibility, and then core strengthening to help with posture and joint alignment. And then some lifestyle coaching to help you with things like getting stronger, getting in better shape. We published this book on Amazon this month on this topic called The Cracking Cycle. So this is a practical guide to spine stability and joint health. It gives you practical alternatives to cracking your neck and back. And there's education for families, because a lot of times I find teenagers start to crack their neck, back, and joints. This book does a deeper dive into the science behind it and gives you clear explanations of what you need to do to stop the habit. If you're in Kelowna, then we're offering you a spinal and joint assessment. I'll give you the QR code in a minute. We'll do a postural assessment, check the joints, discuss your history, and then come up with a plan to correct this bad habit. And we offer other supportive services like shockwave, laser, and rehab support. We do offer health coaching and broader support for things like energy and metabolic health, weight loss strategy, performance improvements, and lifestyle optimization. So there's more to it than just the adjustments. Here's your next step and support options. You can scan this QR code for your initial assessment. If you're outside of Kelowna, you can scan this QR code for your online one-on-one session. And you can join our mastermind classes after this webinar, where we're going to get together for 4 consecutive weeks to discuss what you can do to help yourself. Follow me here on YouTube. You can also follow us on Amazon, where we publish our books. And you can see these books like The Cracking Cycle and The 100-Day Diet. To go to our author page on Amazon, just scan this QR code right here. We're also on social media, TikTok and Instagram, and the handle is at Dr. Cary Yurkiw. I want to thank you for joining me for this webinar today. I hope you learned something about cracking your neck, your back, and your knuckles.